Children in South Africa are going to bed hungry every night. Some of them are not making it. The South African Human Rights Commission had an inquiry. It's found at least 116 children died of acute malnutrition between 2021 and 22 in the Eastern Cape. The inquiry was conducted in the province by the Human Rights Commission last year. The Eastern Cape, of course, is where a desperate mother killed herself and 3 of her children that she could not feed earlier this year. To discuss, we're joined by the head of the Commission in the Eastern Cape, Dr. Eileen Carter. Doctor, thank you for being with us, although this is just too sad to comprehend. And the figure of 116, are you sure about that, or could the death toll be higher? And of course we have to consider before death there's a lot of suffering of children as well.
Good afternoon, Francis. Yeah, unfortunately, we don't think that this number is anything close to being relevant anymore. The inquiry was held last year, and even in July this year, the Minister of Health indicated that severe acute malnutrition cases have increased with 26%. So the preliminary data we've seen from this year looks like it has definitely increased. And unfortunately, we think this is wholly underreported because these are numbers that have been reported by the Department of Health. Now, you would know that would be the children that would end up in hospital. And sometimes they don't end up there. They might succumb to any other non-communicable disease even that was brought or exacerbated by being malnourished.
Yeah, because of course your immune system is very low if you're not eating properly, and combined with this, we know that healthcare has been a huge issue in the Eastern Cape.
Yes, absolutely. Unfortunately, poverty and unemployment is only contributing to this. And what we have seen, unfortunately, is one terrible story upon another. We heard from mothers who would mix the porridge with sand to increase satiety. We heard of special needs schools that are trying to feed children with 4 rand per meal. And because we heard all of this under oath as well, we decided to very clearly make some directions and recommendations. And we made about 38 of them in this report to about 12 different stakeholders.
And I want to talk about those, but just tell me, I mean, it's taken a long time to come out with the recommendations. I think you did this inquiry last year.
Yes, unfortunately, we have to also make sure that we cross our T's and we dot our I's and we include all the relevant information that is out there. But what we have seen is that there is, in fact, no time to waste. When it comes to children, we need implementation as in yesterday. And the best interest of the child principle in the Constitution, Section 28, as well as in a lot of international prescripts, tell us that in each and every decision that we make, we need to consider the interests of the children. So what we've done is we've said that we give departments basically 3 months to come back to us with a plan on how they intend to address the recommendations that we have made in this report. And in some instances, 6 months, but we really urge them to come together so that we can solve this problem.
All right, what are the recommendations? And just tell me, I mean, why is everything so broken? Because there is a child support grant that you would think, okay, helps the most indigent mothers at least feed their children, or mothers and fathers. Why is this happening, and what have you recommended?
So the child support grant is one of the best mechanisms that government has rolled out since the turn of democracy to assist in poverty alleviation and to get food to the mouths of hungry children. Unfortunately, the child support grant hasn't kept up with food inflation. So the current child support grant of 510 Rand vis-a-vis what the poverty food line is of 760 Rand. You see there's a great disparity between those numbers, and the food poverty line is the most basic nutrition that children would need for survival. So you would see there's a disparity there. So one of the recommendations we've made is to say that that number needs to increase. The child support fund needs to increase because it's really an effective measure. The second thing that we looked at is another very, very effective program of government is the National School Nutrition Program. But unfortunately, again, you would know it's a school program. So any child 0 to 5 that doesn't attend school won't have access to at least that one meal a day. So what we've said is that in the interim, government must really look at prioritizing the 0 to 5-year-old cohort, either by increasing and staggering the increase in the child support grant for the 0 to 5s, or making a very, very clear effort to expand the national school nutrition program to very urgently include the ECD sector as well.
This seems to link to other efforts to bring the early child development system in line with basic education. I remember during COVID, schools opened, but desperate mothers still couldn't take their children to a creche. Those were closed for much longer. So do you think that is the low-hanging fruit, to really start aligning those two separate spheres of education?
See, this is not news. This is something that has been spoken about in the relevant stakeholder circles. So yes, what we are saying is that needs to be done now, because the 0 to 5-year-olds, if you go school going, you would have one meal as well as reliance on the child support grant. The 0 to 5-year-olds don't have that. There are ECD subsidies, but what we've seen from the data provided to us is that the ECD subsidies simply do not have the effect that the National School Nutrition Program has. So we have made a range of recommendations to government, and we really urge them to choose and to follow through with at least a few of them, so that we can really address this as a matter of urgency.
Final question very quickly, what about other provinces?
This is absolutely a national crisis. You would look at the stunting rate that was released, I think, around 2016, that says 27% of South African children, or children in South Africa, rather, are stunted. And in the Eastern Cape, it's 25%. So this is a national crisis. And if we look at the poverty line and the increase in unemployment after COVID, we expect that the matter that we are addressing in the Eastern Cape is much larger than a provincial matter. And that's why we have also made the recommendations to be national, and we want to table this report in Parliament as well.